medicine for me was not a direct path. Many of the residents that I was working with thought that I would be better suited as a doctor. It's a real privilege to be in medicine, and it's a privilege to provide care. We allow people to look better, but ultimately what we're really doing is allowing them to feel better.
And that's the most important thing, is that they feel better and feel confident. The way I see it is we see ourselves differently than we did before we were on social media so much. We see ourselves in comparison to other people in a much bigger context than we did. Like, I find hard is whenever people compare to people they don't necessarily know on social media and say, well, I want to look like this. And I'm like, well, that person doesn't even look like that. That's a filter.
In the end, it's about not even happiness, but contentment.
Welcome back to Beauty Unveiled. Today we'll talk with Dr. Anthony Brissett. After getting his medical degree, he had extensive training at the world-famous Mayo Clinic in Rochester, Minnesota. While there, he completed his otolaryngology residency, and while also at the Mayo Clinic, he completed a postdoctoral fellowship in wound healing. From there, he went on to the University of Minnesota to complete his clinical fellowship in facial plastic and reconstructive surgery. If you enjoyed this episode, subscribe, share with your friends and family at www.drangela.sturm.com. I love how you are my residency mentor, and I get to learn all of this today. I know we've talked about it, but not in like extensive detail.
This is true. Some things, get kind of overlooked in the whole process of, mentoring and friendship and all else that goes along with it.
And I think as a resident, you're so freaked out about trying to get the right answer. You're like, yes, that's nice. I'm trying to learn all of this stuff. So why, okay, let me start from the beginning. So why medicine in general?
Medicine for me was not a direct path. So there's probably aspects that you don't know in relationship to my career path as well. Mm-hmm. So you may or may not know that I started off as a nurse.
I only learned that from the fellow who told me that the other day.
Oh, right. Yeah. So I started off as a nurse, and during that process of being a nurse, many of the residents that I was working with thought that I would be better suited as a doctor. Mm-hmm. And so they actually encouraged me to go to medical school. So that's how I got here.
So why did you decide to go to nursing school?
Well, because my parents told me I had to go to college, and they said that there were lots of great jobs in nursing, and it seemed like a reasonable option.
Yeah.
But that wasn't a career path for me that I had thought out. However, I would say that nursing opened doors for me that would have never otherwise been opened for me. Mm-hmm. And one of the biggest things that it did is it allowed me to migrate from Canada to the United States. Mm-hmm. So it was at a time when nursing, as is now, were in short supply and high demand. And so you could literally go to the border, get a visa, get a job.
Yeah.
And so that's how I got to America.
Oh, nice. Yeah. And we're in that place again where there's lots of demand.
Exactly.
So where did you work as a nurse?
So I did not work for long. I worked in a place called Hutzel Hospital in orthopedic surgery, and that was in the Detroit Medical Center. And so I grew up in Canada, and Windsor and Detroit are separated by the Detroit River, and so it was an easy transition. So I actually lived in Windsor, worked in Michigan, and that was my entry to the United States.
Oh, interesting. So obviously the weather here in Houston, winter-wise, probably a lot nicer.
Absolutely. So I'm probably one of few Canadians that move further north when they leave Canada. Right? So Detroit is actually further north than Windsor. Mm-hmm. Michigan is further, Minnesota is further north than Michigan. So that was my kind of pathway. And then from Minnesota, I made my way down to Texas. So I went from what I describe as the world's largest outdoor freezer to the world's largest outdoor sauna. But what I would say is the hottest day in Houston is still far better than the coldest day in Minnesota.
So this makes me feel better because I'd always rather the warm than the cold, and you have experience with both. Because I don't have to shovel anything, any snow. You know how here the whole city like shuts down if we have any of that. You see a snowflake and we're like, close the schools, close work. We're not leaving our house.
Absolutely.
So prefer it here, weather-wise anyway.
I prefer it here, everything-wise. I love being in Houston. Houston's a great city. People are great. The atmosphere is great. Everything about Houston is wonderful. It's home.
Yeah. I love the diversity. I love that, I meet people from all over the world.
Absolutely. Yeah.
I feel like it's a welcoming place too. People are like, oh, you need a website guy? Oh, I've got a guy. If
Absolutely.
I need this, I need that.
Yep, I agree.
What made you do the wound healing fellowship?
Well, within the African and Black culture, there is a propensity for scarring. And that is one of the reasons that I was directed to plastic surgery or facial plastic surgery as aspects in relationship to scar. And so in trying to better understand models of fibrosis, models of wound healing, patterns of scarring, going into the lab allowed me to explore that in a more formal setting.
How do you feel like that's impacted your clinical practice?
Well, for example, today I just saw 40 keloids. So today is my keloid clinic day. Okay. And so I see one Friday a month, I see a keloid clinic. And so in that aspect, it certainly has allowed me to have a greater expertise, and it allows me to help patients that are oftentimes underrepresented minorities, Hispanic, Black, Asian, whoever it might be, because those patients are oftentimes more likely to be affected by these aberrant scarring pathways. So it gives me an understanding for that. Additionally, it's given me a career path in relationship to academic medicine and kind of building upon that. And then also, it's given me the opportunity to understand more basic science-related aspects, which I then put into practice as well.
Did you always feel like you were going to go more that academic route?
I did, yeah. I always felt like, it's a real privilege to be in medicine, and it's a privilege to provide care. And there's a subset of folks that don't have access to care, and there's a subset of folks that need to see people in different roles. And for me, my skill set, my interest, and my desire to contribute is best suited in what initially started off as academics. Now I call it kind of privatemics per se, but I'm still teaching residents and fellows and other aspects, and we're aligned with our fellowship together.
Yeah.
And so all of that makes sense.
Yeah. Anything you would have done differently? Yeah.
Everything. Yeah. If I had to do it all over again, I would do it all differently. Yeah. In a lot of ways, but I wouldn't want to do it differently. And so I think that, the experience that I've had has allowed me to become the person that I am now, and is continuing to allow me to evolve and grow. And so I don't know if I would have done it differently. I really enjoy the path and the pathway that I have. And so, I think, the thing that I'm definitely grateful for is my wife. Right? And so, as you know, I've known my wife since the 8th grade. And so that aspect has allowed me to really kind of be able to kind of enjoy, a soulmate for a long period of time. And that's the one thing that I would definitely keep consistent. And then, kind of anything else kind of works itself out from there.
Yeah. She's a great lady.
She is.
Very smart, very sweet.
Yeah. Yeah, I was thinking about that. One. Yeah, I was thinking about that as I was getting on the elevator, because Art and I have a lot of things in common. One is we have, we have overachieving wives. His first name start with A. Yeah. Second letter starts with an N. And are doing wonderful things. So as are you. So we're very, very fortunate.
So when people ask me why I went into facial plastics, like, you're part of that story. I don't know if you
great.
knew that.
I want to hear it. Yeah, let's hear it.
So when I was a medical student, I was thinking OB-GYN because I liked clinic, I liked surgery, I liked being special parts of people's lives, and then did the ENT rotation where I watched you do a microtia repair. And I was like, that is the coolest thing I've ever seen. You took a rib, you carved it into an ear, you made an ear for this kid, and in my head, like, this goes that you go home and your wife's like, how was your day? And you're like, oh, no big deal, I made an ear today. And I was like, that's the best day I could have imagined. Like, can you imagine that? You made an ear for a kid?
Yeah.
I was like, that's a great job.
No, you're absolutely right. And if you were my wife, should say, that's all you did was an ear?
Really?
It's like, one ear? Did you make 2 ears? How about a nose? Like, Jesus made a whole person out of a rib, and all you can do is an ear. So,
like, it was a great ear, though. You should have seen the ear.
Absolutely. So that is part of the inspiration for you to move into facial plastic surgery. That's a great story.
Yeah. So I was like, that's amazing. You can give that to that person that, that kid that didn't have it, and they have confidence now, and, something that they didn't have before. You're able to be part of that special part of their life. And, obviously I've kind of gone a little bit in a different direction, more of like the cosmetic route, and which I don't get to do things like that, but I do get to give people, a nose they never had, or, their face again when they look in the mirror and like, oh, that's me. It wasn't me there for a while, but this is me, know?
No, absolutely. I agree. And, you probably see that in many ways. We allow people to look better, but ultimately what we're really doing is allowing them to feel better, to have a better sense of self, self-image, self-confidence.
Yeah.
And putting that all together. The looks just happen to be the vehicle.
Mm-hmm. And that's the most important thing, is that they feel better and feel confident.
Yeah, absolutely.
So we both have 2 girls.
We do.
I have the little ones, and yours are more grown up.
Yeah.
And in that vein of like confidence and how they feel about themselves and how they look, how do you feel about, because I've thought about this, I had patients ask me, like, how would I talk to my girls if they were the patient, if they had decided, oh, there's something I want to change, like, what would I say? What would you say?
Yeah, that's a great question. I guess it depends on what they would want to change and the reasons why they would want to change it. And, I think, when people are thinking about change, ultimately we want them to be, having a desire to change that is internally driven and would be internally satisfied. Yeah, it is. I have concerns when I see patients and or family members that want to change something to make others happy. So that would be kind of how I would at least frame it with my daughters.
My family didn't have a vote, and right. So it would be great they'd be able to talk to you about that. Yeah. I was having a conversation before this. I was talking to Freddie before this about, social media and kids and how they see themselves and everything. How do you feel about that in the context of, appearance and young girls? And because I know I see people, and I'm sure you do too.
Yeah. And so, certainly there's kind of aspects of how people see themselves, right? There's aspects of, how we see ourselves, how others see ourselves, how others and ourselves see ourselves, and how nobody sees us. And you want to kind of have this balance, right? I mean, you don't want to have this biggest aspect of how others see us and how we see ourselves as just kind of tiny. You want to create this balance in general. And I think in plastic surgery, oftentimes it's skewed to one aspect or the other, and sometimes it can be skewed to one body part or the other. And so, trying to work on that balance, I think, is a challenge. And as you know, my wife is also a psychologist, and so we have this, kind of exchange in terms of, kind of the psychological impacts of, kind of body image and, aspects in relationship to therapy in order to kind of restore that. And it's a challenge. What are your thoughts? How do you look at it?
I see people, the way I see it is we see ourselves differently than we did before we were on social media so much. Because I think people see angles of themselves that we never see in real life. We see ourselves in comparison to other people in a much bigger context than we did. Like when I was in high school, I knew the kids that were in my high school, mostly in my grade, not even in other grades. And now, you compare to everyone that's out there. Like your view of your social circle is so much bigger. And so that can be a really positive thing, that you can see things that people doing, or it can be not as positive when you have that element of comparison. And so that's the thing that I'm going to say struggle with, but that I find hard is whenever people compare to people they don't necessarily know on social media and say, well, I want to look like this, I want to look like this. And I'm like, well, that person doesn't even look like that. That's a filter. Well, this person doesn't look like that because they alter that. I can tell you by looking at that. That's not real, of dealing with that. And it's interesting, the age group, because the younger kids, no, they don't do that. It's my age group. That the filters were obvious. It was like dog ears, It wasn't this realistic AI filter that looks like you have makeup. It looks like everything's perfect, and so it's not something we grew up with, but we're getting into that age of, what is this? Oh, what is this?
Right,
that was not there before. And then you're looking at people that are your age group, but they've had work done, or that's a filter, having to have that talk of like, I've had the conversation of, I'm not going to be able to make you have no lines on your face. Like, that's not realistic. And, we need to talk about what's realistic.
Yeah. And, I think to me there is, kind of a dichotomy, and I think appearance is one thing. And I think there are a lot of people that are looking and, kind of fixated on social media, and they want to change in their appearance. But I actually think the younger group, it's more of a lifestyle. They want the lifestyle that they see happening on social media. And they think that, the appearance may have some impact on how they're going to achieve or obtain that lifestyle. And, the lifestyle that they're wanting to obtain is artificial. Yeah. So then that kind of brings like a whole other discussion about kind of the metaverse and, kind of where you're going to live and all sorts of other aspects that I think are interesting discussions. But as it relates to plastic surgery and other aspects, I think that, there's a pursuit for appearance, and there's a pursuit for image, and there's a pursuit of lifestyle. And, neither one of them are congruent.
Yeah. Because there's this idea of, if you're an Instagram model, then, you're going to get paid for doing social media and you don't have to have a real job or, and then you're going to live in these beautiful houses and things like that. And like, well, that's not the norm. That's not the average. And those people probably don't even have what it is that they're, posting online. I think, that makes a lot of sense.
Yeah. Yeah, no, absolutely. I think, in the end, it's about not even happiness, but contentment. And so, you don't have to be happy, but, it would be good to be able to be content. And, I had a very same discussion right before I came here. Part of the reason why I was late, was a patient that had a tertiary rhinoplasty. Her nose looks beautiful. She's really happy with how it looks, but she's concerned about what might happen.
Right.
It's like, I've watched online and people said their noses may collapse, or people say cartilage gets infected, or what happens if it gets hit. She's happy, but she's not content. And, how do you, you can't impact that. We can do all the things that we want to do, but it's hard for us to change the psyche.
I think I would love your take on this, because I feel like, especially revision rhinoplasty, there's this element of PTSD, if they've done this before, it didn't work out. So even when it looks great and they're like, I'm happy, but I wasn't happy before, is something going to happen? When is the shoe going to drop?
Absolutely.
And you have to be that cheerleader and be like, no, you're doing great. No, put the mirror down.
Exactly. No, you're absolutely right. I oftentimes wish that the comfort and enthusiasm and energy that people go into a primary rhinoplasty with could be duplicated once they find themselves in the right location for a secondary or a tertiary. But by that time they're wounded, and they're not content, and there's some of the damage has already been done.
Yeah, and I feel like it's from like that first consult, because like you said, the damage has been done, and it's feeling comfortable with, okay, I'm going to do this again.
Yeah, I totally get it. And that's some of the aspects of plastic surgery in general. And so when you look at the psyche of, or the cycle of plastic surgery, we can go from kind of contemplation to action, and then from action, what is the final point from there? And some people go from, and what does action look like, right? Action could look like going online, from contemplation to going online, or from making a phone call to having a consult, whatever it might be, whatever action looks like until you get to the end point of having surgery. And so, the challenge is, appreciating that process as a surgeon, and realizing that, yes, we see every single person we see is in action, right? But the great majority of people are actually stuck in contemplation, and we have to be as energetic, as enthusiastic, as empathic, for every single patient, even though those are the only patients we see. And it's important, not just for us, but for our staff as well, to recognize that this is a unique experience, and a unique ride for each patient.
I agree. I have that talk with them, with the staff and with the patients too. I'm like, we do this every day, but this is, this is something new for you. You're not going to know what's normal. You're not going to know what's okay, and so this is why I see you a lot. This is why, call anytime.
Absolutely.
I know it's a big deal. And I think about this, and, that every surgery we do is a huge part of someone's life. That's a major thing that they're going to think about and remember. And, and it's somebody's mom and somebody's sister and somebody's,
Yeah, no, absolutely. Yeah. Yeah. It will always be a part of their life. Right. And, it won't be a huge part forever. And eventually, if done well, we don't
even think about it.
We will just drift off into the corner of their photo. And just be a little dot.
And be like, I had rhinoplasty. I couldn't remember his name.
Exactly.
Perfect.
Absolutely. But we'll always be a part of that picture.
Yeah. Which is one thing I love about it. I get to be a part of their journey. Yeah,
we'll always be a part of that, which is really special.
And a part of your practice that I think is really cool is you get to do reconstructive surgery and give people life back, and things back. No,
absolutely. The part of my practice that I love and that I see myself trending towards is the international missionary and global related aspects. And so, I just got back from Ghana last week, where I was with Dr. Bohaney and Dr. Gasner, Dr. Sofola, and other friends, standing up a hospital to primarily train other surgeons in the West African region. That is building. So cool. It's so awesome to be a part of something that's going to build capacity and to be able to provide opportunities. And I tell all of my patients, some of my patients, facelifts, rhinoplasties, whatever it might be, sometimes are a little uneasy, saying, you're doing all of that stuff here, and here I am, And what I explain to them is that it's a whole, it's a group, and so what I do here allows me to go there. And so we're doing this as an ecosystem, and it's all working together. And so last week was Ghana. 2 weeks from now will be Ukraine. And then, it just kind of keeps on going.
So how did you get into that?
Years. Making ears.
Okay.
And so I've always had an interest in international missionary work and medical missions itself. One of the early introductions was actually in Ghana with Dr. Bohani doing cleft lips and palates. And then we moved to Russia. I was in Russia for about 10 to 12 years, primarily doing microtia and other aspects on some clefts. And then when the war started in Ukraine, that then really forced me to shift directions, because I'm not going back to Russia. We denounced all the activity in Russia and then pulled our entire foundation out and redirected all of the efforts to Ukraine. And so that's how we got to Ukraine. Nice. And it's been, we've now, we'll do our third mission there. We've cared for almost 100 patients, done over 300 procedures, and it's making a difference.
Yeah, it's pretty amazing.
Yep.
So my last question for you is, what is your advice for someone that wants to do what you do?
Run. No, not at all. I think that one has to pursue their passions. One has to be prepared, and then look for the opportunities. And so there's this saying which is kind of always fly first class, which is not necessarily fly first class, although there's nothing wrong with flying first class. I like it. However, what I mean by always fly first class is just always try and get the best experience, be in the, take advantage of the best opportunities. Don't sell yourself short. If there's opportunities that present themselves, then, take advantage of those opportunities in the best possible setting and venue and format as you possibly can.
Absolutely. Makes sense. So if you're not in the medical field, whenever an attending asks questions to a resident, we call it pimping. And so thank you for letting me pimp you today. I get to turn the tables and ask you lots of questions. Yeah,
that's good. These opportunities are great to be pimped, especially in this sense, because it allows one to reflect on their path and to reflect on their past, and kind of think about how it can be impactful and impacted.
Well,
so thank you
for sharing.
And let me also share that I'm very proud of you as a mentee, mentor. You are doing wonderful things in Houston, wonderful things in your community, wonderful things in medicine, and wonderful things in our academy. And so I'm so grateful to see how you have continued to impact medicine, women, healthcare, and families. I'm very proud of you.
Thank you.
You're welcome.
That means a lot. I really appreciate that.
Oh, absolutely.
So thank you for being with us. Such inspirational stories, and it's wonderful you were able to share with everyone. And so if you enjoyed today, like, share, subscribe, share with friends and family. Tell us how people can find you, your website, social media. What's the best way to find you?
Anthony, drbrissett.com is a great way to find me. You can find me on Instagram, AE Brissett, I think.
You're very active, I can tell.
Exactly, that's right. And you can certainly find me through Houston Methodist Hospital as well. So all of those options are great ways. If you're interested in any of our foundations, it is Face the Future, which is a Canadian foundation, and also our focus organization, which is West African Institute of Educational Surgery, Aesthetic Surgery, something like that. Look it up.
You can find it. Google it. You'll find
exactly,
it. Yeah. Well, thank you. And you can find me at www.drangela.sturm.com, and all social media is Dr. Angela Sturm. So thanks again, and like and share, subscribe. Thanks for watching.